I think our approach is not entirely different, but just a little bit different twist. When Forks Over Knives came out, I got a little bit of an education because we had always focused on holism. I'm a Colin Campbell fan, and he's written a great book called Whole, Rethinking the Science of Nutrition, but this can be applied to everything. In other words, medicine is a very reductionist enterprise, all right? Everybody sees a gynecologist and a gastroenterologist and a nephrologist and a rheumatologist, and everybody specializes in a body part. Nobody's paying attention to the whole. So that's the first problem that you have. And the second thing is that dietary change, I totally agree with Dr. Goldner that the dietary change by itself won't fix everything. And so there are a whole lot of things that we focus on. One is exercise and hydration. Our people have live classes every week. When people join Wellness Forum, they're told that they will be expected to do research in our libraries. They will be expected to participate in classes, and we offer a great deal of support in addition to the one-on-one help that we give people with everything from making meal plans to role playing how you're going to have a conversation with your doctor at the next visit. But I think the key is that I learned after Forks Over Knives, we got an influx of what I call the sick vegans who were eating perfectly, but they were still in the medical mill. They're still getting a DEXA scan, which is useless for diagnosing bone health. They're still getting cancer screenings that are more harmful than helpful. They're taking supplements from their local naturopath that maybe don't have much value. And so we really look at the whole picture. We basically say, look, we don't want to join the reductionist bandwagon that you're on. Okay, so you keep all that other reductionism going on, and we're going to come over here and just focus on food and psychology. So it's a very whole person approach to health, and the idea is to change the relationship that people have with the healthcare system, not to disconnect them from it, but to make it more like the way that they make decisions about everything. I mean, I've never heard of anybody who stood in the driveway with a realtor and said, I'm so stupid about real estate, you're going to have to tell me where to live. But people will walk into a doctor's office and say, I'm too stupid to know anything about this, so you'll just have to tell me what to do. And my experience has been that if we don't change that dynamic, they will continue to interact with a system that is designed to herd them into sick care. They'll find the more testing you do, the more likely you will find something to pay attention to. And that's evidenced by blood tests. 27 years ago, when I started in this business, people would come in with a blood test that was 2 pages long. Now it gets delivered in a UPS box. And if you're going to look at all that stuff, you're going to find a ton of abnormalities. You can keep people very nervous about their health. And this is the medical mill, by the way. This is the medical mill. We suck you in and we diagnose you with lots of stuff, some of which may not even be real. And then we treat you and we treat you and we treat you and you get sicker and sicker and sicker. And so our goal is to get them out of that mindset that hanging out with doctors and constant testing is the pathway to health. It's not. And they do need a doctor. We won't work with people who are not connected to a physician. So it's not withdrawing them from the medical system that way. It's changing their relationship with it. And we think that's very important.
Actually, I just need to add something to this, just because there's one area where I disagree. That's really important. People with autoimmune diseases, sometimes medical care is life-saving. And so what I found in my experience working with people is that they do not need to get off their medications to heal. In fact, they recover fully. And then once they've shown their doctors they're well, then they're able to taper off safely. I've been very nervous about it when people will say, oh, I'm going off my medicine for my lupus or other diseases because I want to go ahead and try the nutrition. And I really like to bridge that gap. I mean, I'd be dead 30 years ago without medication. I had 6 months to live without medical intervention, and I had to do experimental treatments that saved my life. And so the good news is, what I found is that the testing and the treatments do not interfere with their ability to recover, but it can keep them alive while they are learning how to incorporate that nutrition, because it's not usually right away that people do what they need to do to eat right to get their health back. And in the meantime, they're racing against a disease that could take their life. So I just want to caution folks not to demonize the doctors that are trying to save their lives. They don't know about nutrition most of the time, although nowadays they do more. I have a lot of people tell me that their doctors are excited that they're working with me. I get referrals from doctors and I educate doctors. And of course, once doctors get sick, they Google and they find us that way too, right? But it is really important to understand that there are, that we can marry the two. And that's where I tried, obviously I'm a medical doctor, I'm a genetic researcher in the past, and I'm also a former patient. And most of the time I'm helping people get off their medicines. But it is, I think, most important for people's safety, not to feel like they have to choose a team, that you're either in the realm of natural and avoiding medical care, or you are purely going to follow medical care, but that you can do both. And I do agree that people should make wise choices and educated choices, but that medical care can also be really important for people and keep them going while they're trying to do everything else for their health. And like I said, I haven't seen it interfere with recovery at all for people to be on medication.
Well, I think I've done the worst job ever of explaining what we do, because if anybody got the idea that we're trying to disconnect people from their doctors, that's not it at all.
Well, I heard you say that medications make people sicker and can make people worse, and side effects are real, but medications can also be life-saving. So I just wanted to caution people not to take it that way.
Well, we certainly don't take it that way either. We want people to stay connected to their doctors. And we find that many times people complaining about their doctors, when they go back and they're more proactive about their health, their doctors light up a little bit too. I've told every patient that I've dealt with, if you're going to flop your body in a chair and say, fix me, you're probably not going to get the best medical care available, right? So even doctors that people complain about become better doctors when patients start having conversations with them. I have never in 27 years suggested to somebody that they discontinue their medications without speaking to their doctor and just jump in and do diet. In our world, they start immediately adopting better habits. And while they are doing that, they keep in touch with their doctor. And I'm sure we deal with people who have lots of conditions other than autoimmune. And I'm sure you would agree that a person who isn't withdrawing from beta blockers and calcium channel inhibitors, who aggressively changes their diet, is going to drive their car into a tree if they're not talking to doctors about withdrawing from drugs. So we've never told somebody not to take their drugs. What we are trying to do is to change the relationship that people have with the medical profession. The medical profession has done a wonderful job of convincing people that this is just all so complicated that you have to follow directions. And as I've said, I tell people, you have made very complicated decisions in your lifetime, some of which cost hundreds of thousands of dollars, like buying a house, and you didn't claim helplessness, and you shouldn't do it here. I've never met anybody. I have middle school students who we have been able to make them functionally able to read medical journal articles and understand what they say. And when a medical journal article essentially says, this drug will reduce your risk of something happening by 1/7 of 1%, you have to start asking why you're taking it. When the risk benefit ratio, or the number needed to treat, is completely off the rails, it is reasonable for people to have discussions with their doctor. Listen, if 360 people have to take this drug for 17 years for me to benefit, what the heck are we doing here? I think those are the kinds of
being educated is important. Yeah, by 16, I was able to understand every laboratory test that was ordered for me. And most patients I see, no one's ever even told them what the tests are, but they've also never asked. So I definitely agree with that. And for every single person I see, I do 75-minute sessions, and I actually teach them what every line of their lab test says. And they say that's the first time they've ever had that experience. And meanwhile, there's been doctors ordering these tests. They have the tests. They don't even know what they are. So I think that's really wonderful to empower people to understand and also to then make those decisions. I've always kind of worked outside of the insurance realm too. When I worked for the nonprofit with the homeless, those are such high-risk population. They let me do what I want. Even if I wanted to spend a whole day with a patient, if that's what they needed, I would do that. And even now I do the same. But it's unfortunately in the medical world nowadays, doctors working with insurance paradigms, they have 10, 15 minutes and all they have time to do is read a set of labs and maybe order a medication. And it's a disservice to the patients, but also the doctors. Unfortunately, a lot of times doctors are maligned, like they want to control people, or they want, they're not interested in people's health. Where everyone I know who went into the profession earnestly wants to save lives, and then they get frustrated that they can't. So I think it's great if you can empower people to understand your labs, have good conversations with your doctor. I always tell people, don't to ask them to sit down so you can talk to them. Don't let them stand in the doorway. Ask them to sit down and say, I have some questions. I think that's going to be important. And I think that the whole profession is going to need to shift in some way, because it's just the way the system is controlling the doctors themselves really limits their ability to be effective. And I think it's one of the reasons why people are not diagnosed quickly enough, because they just don't have the ability. Yeah.
Okay, so let me ask you a question. You could write this down. I want 10 questions I'm going to ask your opinion on. So I want to get your feedback on these 10 points. And you could just give me what you think. So the first of the 10 things, I'm going to give you all 10, and then you can answer all at once. So your opinion on 1, salt; 2, oil that goes on your food, like hemp, flax, olive, chia oil; 3, fats such as olives, raw nuts and seeds, avocados; 4, fruit. Brian Clement says fruit feeds yeast, mold, fungus, candida, and cancer. 5, hyperbaric oxygen chambers. Are they something special we need to know about? 6, far-red infrared saunas. Is this something that everyone should be taking every day to get all the toxins, heavy metals, and pest poisons out of our body? 7, supplements. Are there a list of supplements that you recommend everyone takes? 8, fasting. Should this be a regular part of our life? Should we be fasting every year for a week on water? 9, what medical tests do you recommend healthy people get? Is there any that you recommend we get once a year, once every 5 years? And number 10, are smoothies okay because we're concentrating the fruit and making it more sugary? So is that an appropriate thing, or is it too sweet? So if you could each tell us your feedback on these 10 things, that would be great.
You want to go first, Brooke?
It's all right. You got it.
Okay. There's no reason for most people to restrict salt. About 5% of the population has an issue with salt. And the research is becoming increasingly clear that when you restrict salt to extreme levels, you bring on some of the same problems that excess salt brings on. And by the way, one of the reasons that this becomes important is that if we're looking at how to make this easier for people to do, salt, people like salt. We have taste buds for salt. The argument for eating fruit is we have taste buds for sweet. We have taste buds for salt, but we're going to ignore that. Doesn't make a lot of sense to me. But the research is quite clear. I've written several referenced articles on this. I think getting the oil out of the diet for the most part is a good idea. I don't think you have to become ridiculous about it. I watched somebody with abject horror wiping off asparagus in a restaurant with a towel because it had a little shine to it, claiming that she was going to die if she ate it. I don't think that that brings people to the table saying, I want to be like her. Let's talk about healthy eating. It's kind of bizarre behavior. But having said that, 2/3 of the people in our country are overweight or obese. And so a product that has 14 grams of fat per tablespoon is a little counterproductive if you're trying to address that. High fat foods, it's the same thing. A cup of avocado has 21 grams of fat. We don't take these foods like cashews or avocados out of the diet. We basically suggest that when they're in a dish, great to have, but people go to the grocery store and buy 5 avocados and go home and figure out what to do with them. We're going to put it on toast this morning and we'll put it in a salad tomorrow. And they have no idea the calorie and fat density of the food that they're eating, and then look at their weight status and say, I don't know how this is happening. I'm eating plant food and that sort of thing. So I think there's a place for higher fat foods like avocado, but it's at the top of, we have a food pyramid that shows people the eating scheme, and it's closer to the top. There's no problem with fruit. I've never read a study that shows that there's any problem with fruit. Type 2 diabetics do not become diabetic because of fruit. They become diabetic because of fat, too much fat in the diet. Glucose escorts fat into the cells, among other things, insulin, escorts fat into the cells as well as glucose. And one of the things that happens when people adopt a lower fat diet, if they're a type 2 diabetic, is that fat comes pouring out of the cells, and results are pretty fast in terms of reversal. I think there are uses for hyperbaric oxygen and infrared sauna. I'm very reluctant to have these very long, complicated lists of things you have to do to be healthy, because we have to recognize a certified public accountant during tax season can't quit preparing tax returns because I got to eat these 12 foods for lunch, and then I got to do this, and I forgot to do that, and I got to go sit in a sauna. Having said that, I have a rheumatoid arthritis patient who one of the things she's done to keep herself from deteriorating and taking medications is she has a sauna in her house. I think that's great, but to suggest that everybody should do it, I think is a little misguided. I think B12 supplements are important for people who eat a vegan diet. I take one. I think a probiotic is sometimes helpful. And then after that, it's depends on the condition. So this idea, here's the 12 supplements I think everybody should take. Gosh, it just makes you wonder how humans survived when we had far fewer food choices and we're wandering the earth, and sometimes we didn't even have enough to eat. So I don't really agree with that. I think fasting is wonderful. I've sent about 500 people out to Alan Goldhammer's place, and I've sent dozens to Dr. Gracie's place right here in Ohio. I think it's fabulous. Does everybody need to do it? No. Is it a good idea for some people? Can save their life for many people. Medical tests recommended. The only test, the cancer screening test that actually has been shown to reduce the risk of dying of cancer is Pap testing. We now have even a randomized control trial. We didn't have one until late last year on colon cancer screening, showed it's useless. Doesn't even prevent, all that polyp snipping doesn't even prevent the development of colon cancer, let alone dying from it. And there is no evidence to suggest that there's any problem with smoothies. And one well-known doctor has a couple of references on his website for that. We checked them out in a research class I teach, and they don't say anything about smoothies. If you go read those studies, they absolutely are not an argument for not consuming smoothies. So if people like smoothies, that's fine to eat smoothies. I have one every day myself. But if you don't like them, there's no mandate to have them either. I think everybody's different in that regard. So that's my quick and dirty rundown of 10.